our President and CEO, Sharon Closius. Sharon?
Great. Thank you, Val, and good morning, everybody. And thank you all for being here. Before some of you got on, I was saying these Monday morning meetings at 8 o'clock in the morning concern me because I never think I'm going to remember to get on. So I'm so glad all of you are here. And I cannot believe we are kicking off another community index, which is really cause for applause. And if we were in a room, I'd ask you guys to applaud because I'm telling you, it's really, really wonderful. I look around and I see so many names that have been here even before I was here doing the Valley CARES report and putting all that together and understanding the importance of the data. And then when the health groups had to start doing the community health needs assessment and to do the CHIP, it was this group basically, or the previous people in your positions that said, you know what, let's not reinvent and do it duplicative. Let's have one single solitary index. And that is what happened. And so now we're embarking on the third one of the community index, which has all the different components all into one single document, which is just amazing that we are able to do this. And we are able to do this because of all of you, but also because of DataHaven. Mark Abraham's going to come on in just a minute and is going to be talking about all the different components. But before we get into all of that, I'm going to turn it back to Val, who's going to talk about all of the ways in which everybody gets to participate here and how she'll be working with each and every one of you and really appreciates, you know, all of the input and working as a team to get this index to be our very own here in the Valley. And that's what is really great. So Val, can I turn it back over to you?
You sure can. Thank you, Sharon. Good morning, everyone. Again, my name is Valerie Knight-Di Gangi, Val from the Valley. I am the program officer and the project manager for the Community Index work for 2022. I am so glad and grateful for all of your time and effort today. And I just want to run through a few things of how, just quick housekeeping. Just please make sure that you are on mute. And the session is going to be, is recorded. So if you have colleagues that are unable to join us this morning, they will be able to listen to it at a later time, and we will make sure that it gets up on the web very soon. As far as the index goes, I echo Sharon's comments. We are very excited to be here with all of you, to be looking with DataHaven and our partners and every one of you on this call at the data that has been shaping our Valley for the last 3 years. As you all know, that there is a significant component that is going to appear this year that has not appeared in the past, and that, of course, is the effect of the pandemic and what it has meant to our Valley residents and our Valley families. I just want to outline a couple of things as far as the work going forward. I know I'm kind of starting way far ahead of where we are, but I wanted to share with you that we will be dividing ourselves into work groups as we have in the past. In the past, we had several work groups. We had one that was working on the demographics for the Valley. We had a health group. We had early childhood and education, which were combined. We had seniors, and we had economic opportunity. We would hope that you would be able to self-select based upon your content area of knowledge, which work group you would like to participate in. As some of you on the call know, we welcome your participation in as many work groups as you can make. We have found that this time frame, the 8 to 9 o'clock time frame early in the morning, seems to be the best. And as we go forward from this day on, we will be scheduling meetings, and I will have a list of what the meetings will be. All of the meetings will be on Zoom to allow for participation and allow for pre-work meeting, which I think will hopefully be helpful to all of us. We will try and keep the work groups to no more than 1 hour. Other than the health group, we will be meeting perhaps a couple of times a month. The health group will be meeting much more regularly because there is a lot of work to do. And I will be turning the program over to the health group representatives in just a minute, because you will hear how important and how much this particular report drives the work that they are doing out in the community, as well as the work that all of you are doing. So I'd just like to leave with a couple of things. One of them is for you to feel free to contact me via email, via phone, and speak to me about any of the major issues that you see in addition to the ones that were previously covered in the 2019 index that we want to make sure that are covered in this index. And also feel free to send me an email as to which work group that you will be participating in. And in just a minute, I will be able to make sure that you have the list of them. I'll drop them in the chat. So what I'd like to do right now is to turn the program over to my colleagues in the health group, Jessica Christie, who is the Executive Director for the Naugatuck Valley Health District, and Monica Orris, who is the Director of Population Health for Griffin Health Services. They will be sharing between the two of them the information about the health chapter specifically and how the index has not only fulfilled the work that they are doing as far as reporting goes, but also to frame the work that is happening out in the community and will be happening out in the community for the next 3 years. So Jess, I'd like to turn it over to you first, and then we'll hear from Monica.
Good morning, everybody. Thank you, Valerie and Sharon, for that great kind of introduction and reminders of just all the work and partners that have played a role over the years, and kind of our history of the development of our community health assessment and the outcome of that, which is our community health improvement plans. Val mentioned that there's going to be opportunity for you all to participate in working groups and to have your voice heard and represented in the development of the index, as well as the CHIP that will follow that. So we are looking at potential dates in June, specifically June 9th for community conversation. We are still finalizing location details, but we thought it would be great to have 2 sessions to provide more opportunity for people to participate in. So we will have an afternoon session and an evening session. Again, we want to be as inclusive as possible. And when we were thinking about that too, and sort of how the pandemic has shifted a lot of what we do, kind of in this virtual meeting space and opportunity, we thought that we might launch for the first time a way for online participation. And specifically when we were thinking about this, the intent was to try to get more of our grassroots community members involved and represented as well. So, the index, and Monica will talk a little bit more about sort of the plan at large and how it informs the CHIP work, but it paints a picture and tells a story of the Valley communities, both individually and together as a Valley region. And it's used by us as professionals in prioritizing our work and, accessing funding for different projects, for thinking about policy change, for, a number of reasons. But it's also really important that it is representative of, our community and our community members as well. And it's something that we want to be a useful document for them. And I see, Valerie is adding in chats in the comments. So if you didn't call in, again, this will be recorded and you can take a look. But, it's telling a story about not just our medical health status. It's everything from the basic demographics to economic growth. We've seen such a progression here. And then, as Valerie mentioned, the other chapters as well, including early childhood, senior services, the social services that have been provided. And we know that all of you have worked so hard, not just, in the last 2 years in the pandemic, but over the course of really enhancing the Valley and bringing the Valley together. So we want to make sure that we highlight all of those things in the next iterations of both documents. So with that, we ask that you really consider joining and lending your expertise to one of the working groups, but also to make any referrals of people that you think may, have valuable input and may be interested in this process too. We want to make sure that we highlight, things that we maybe haven't in the past, such as equity and cultural competence and influence in our documents. And, there's things and agencies and organizations and projects that are going on all the time here in the Valley. We're so rich with that stuff that we don't want to miss anything. And the data that Mark and DataHaven pulled together and worked so hard on surveying and compiling is just really, really awesome. But we also have other data sources too. So if there's something that you think might be beneficial to include that hasn't been in the past iterations, we again ask that you share that with Valerie, and then she can, forward it on as appropriate. So I think I'll turn it to Monica next, and we'll go from there. But again, thank you everybody. Happy Monday morning. And like Sharon and Valerie, we at the Health District are really encouraged and excited to just jump into this next iteration, not because it's required by us or for us, but because it really does help us understand, trends and where we're going and where we've been and how we might be able to actually affect change right here in our communities. So Monica, I will turn it to you now.
Great, thank you, Jess. Yes, my name is Monica Orris, Director of Population Health at Griffin. Good morning, everyone. I did want to say just a really quick shout out to Sharon and to Val from the VCF, who have really been a backbone in this process. Without them, it's so much harder to pull this stuff together unless you have someone that really helps coordinate and organize. So thank you to our really fabulous partners in the Valley. And this is my second iteration of the Community Health Needs Assessment, or Index. I came to Griffin about 4 years ago when the 2019-2021 needs assessment was just being developed. And I definitely feel like I have a little bit more background of the Valley and some knowledge about how the community works, and really looking forward to the process this session to see some of the changes and improvements that we're looking to make. So I'm going to just give a background about what the Community Health Needs Assessment is and what its impact really on Griffin, as well as the Naugatuck Valley Health District. The CHNA, Community Health Needs Assessment, also known in the Valley as the Community Index, is an important collaborative document. It's meant to inform the community about its strengths and weaknesses in the most simplest form. It's really the result of data collection, analysis, community conversations, and discussions about the health of our community as a whole. It's meant to be used as a roadmap to develop strategic endeavors to build, sustain, and enhance the quality of life in the Valley. The index meets Griffin Hospital's IRS requirement, which all tax-exempt hospitals complete, and this is part of the result of the Patient Protection and Affordable Care Act. It also fulfills Naugatuck Valley Health District's requirement for a community health assessment as part of its national accreditation by the Public Health Accreditation Board. And this is true of all local health districts, as well as any of the not-for-profit hospitals in the state. This is a requirement. The cycles have been varied in the past with the other hospital organizations, where the 3-year period was not always matching Griffin's 2019 to 2021. The new session is 2022 to 2024. I will say I've been fortunate to be a part of a few of the state Connecticut Hospital Association meetings, and the hospitals have aligned their sessions this year. So there was a couple hospitals that were not in the same time period, but they have changed to make us all the hospital systems that are doing these assessments are now going to be in the 2022-2024 time bracket. The index serves as a foundation for the Valley Community Health Improvement Plan and also helps support many of our local organizations as we try to understand what's happening in our region. It also acts as a catalyst for collaboration, coordination, program development, and supports funding applications, to Jess's point. The Community Health Needs Assessment, or CHA, helps track the health status of individual towns, also the collective community, and compares the Valley data to state and national populations. It also includes information on seniors, social services, economic development, youth well-being, maternal health and early child development, education, and much more, as Jess mentioned. The statistical data and desired data collection is really straight from you through our census data, through some of the other data collected through CHIME. And when Mark discusses the well-being survey, you'll see that this is information that's really collected from our community and representatives of our community. And we know, again, this year, we're going to have a fabulous community health assessment, because I do feel that the Valley is such a collaborative environment and really gains a lot of information from our community members. And just to remind everyone, the CHIP is developed by narrowing down major challenges or priority areas identified in the CHA and pulling together community organizations and community members to work together to affect change that hopefully will impact some of those priority areas. As a result, the CHIP draws from local community health needs assessment and the expertise from our community representatives. The benefits include improved coordination, organization, and collaboration, increased knowledge about public health and the interconnectedness of all the activities we do in our region. Also strengthens partnerships within the state and local public health systems. One of the things I wanted to share today is that, again, I've been part of probably about 3 or 4 different committees that are part of the community health needs assessment. And the state has, many of the state stakeholders have known that the CHAs and CHIPs have been going on in the state for years, but they didn't pay that much attention. I think one of the things that the COVID pandemic has done is it sort of peeled back some layers of a lot of the great work many of the regions are doing. And what they're doing is trying to figure out how the state can move in a little bit more of an organized fashion as a whole to address some of the common issues that we're finding in our community health needs assessment. So I think there's going to be a lot more information from different state leaders and groups on how all the hospital systems and health districts and communities could come together and really focus. You know, there's strength in numbers. And I think having all of the systems working together will hopefully be able to tackle some of our larger state issues in the same coordinated fashion. There's definitely an alignment, to Jess's point, to align health systems, health districts, and communities to really focus on inclusivity and figure out what our community members, those hard to reach populations that we've had struggle maybe accessing before, looking really for this group and many others, hopefully, as this work gets started, to really find the members in our community that can really help us identify issues that are affecting them, whether it be food, affordable housing, workforce training, behavioral health, and looking for commonalities in our communities and seeing if they do align with some of the state initiatives as well. So main focus is going to be on health equity and inclusion. We're looking to hear from community members and organizations, including those that are hard to reach, whether we could find those that are undocumented to survey to see what's affecting them in their community, in their health, in their well-being. So really looking forward to this group to help us drive the work that we're doing around the community health needs assessment and around the community health improvement plan to really impact our community as a whole. So that's a really quick summary, but certainly I think it's the work that we've all been doing for the last 3 years. And again, our new CHIP and CHA will be the 2022 to 2024 bracket of work, and look forward to working with you all in upcoming workshops and upcoming meetings. Thanks, Val. Back to you.
Thank you so much, Monica and Jess. As you've heard, we are very committed to making sure that community voice is a significant part of this next index, and to really hear from those most impacted by a lot of the data points that you're going to be hearing from DataHaven in just a few minutes, of how important that is in the work that we are trying to address these issues going forward. Before I introduce Mark Abraham and his team at DataHaven, I just would like to take a quick minute to introduce Allison Johnson, who is our writer and consultant for this work. Allison has just waved her hand. She will be working with the work groups, and feel free to share information with Allison, because the more that you can share and the more that she understands what the needs are in the Valley, the better this report will be as it relates to the specific framing in the paragraphs and the narrative writing of this report. So welcome, Allison. We are glad that you are with us. And now, without further ado, I'd like to turn the program over to Mark Abraham. Mark and DataHaven and his team have been working tirelessly with us for almost 7 years now. Back in 2015, it's been quite some time. And we are so thrilled to be able to embark on this journey once again, because there have been a lot of trend data points that have developed over this past time. So Mark is going to share some of the data with us this morning. And as I said before in the chat, if you have any questions, please feel free to put them in the chat, and I will make sure that Mark sees them so that we can hopefully address them before we end our program today. Good morning, Mark. Thank you for coming.
Good morning. Thank you, everyone. It's good to see everyone again after a couple of years, maybe not seeing everyone. So yeah, this is really exciting. The Valley does this community health assessment in a way that's different from the other hospitals around the state in terms of, strong collaboration, sort of going outside the health area, looking at social drivers of health, which is really great. We work with pretty much all the other hospitals in the state, and none of them have this really, community-driven process for their assessment. So really excited to work with the Valley again on that. I'm going to share screen. Sorry, I'm fighting a little bit of a cold, so I apologize about that. And we'll take you through a few data points. So first, it's, as people mentioned, the index uses many different sources. There's local, state, and federal data. There's data that you have just within the Valley that the health district has, or the agencies that are represented on the call today have. So really, we encourage you to share those with Allison and with the team so we can make use of those. Just, some background, looking at the 2020 census that just came out, population growth in the Valley, the population's changing in a way that's very similar to the rest of the state as a whole. But then within the Valley, you do see some shifts. So for example, if you look at Shelton, most of the housing units built in the Valley over the past 10 years were in the town of Shelton, and specifically in like the downtown area and the areas right just bordering Bridgeport. So it's important to keep that in mind that, the population is changing. Once we get the more detailed census data that comes out in the next few months, we'll be able to really pinpoint which populations are changing, where there's, growth in households or singles or older adults. So we're really looking forward to that 2020 census data that, it's only partially come out so far. And hopefully in the next few months, the full data set will be released. But this is, important kind of context. Another thing that the census measures is how people report their own race and ethnicity. So this is the child population in the Valley for 2020. And you could see just how diverse the population of children in the Valley is. And also the population of adults has also grown much more diverse at a rate that's faster than the change in the state. So we have more residents who identify as Black, Latino, or mixed multiple race categories, particularly in the larger towns in the Valley. So I'll talk mostly about the survey results, because that's what we just finished conducting, it more exciting. So this was the 5th time we've done the DataHaven Community Wellbeing Survey. We got advice from organizations like yours throughout the state in terms of what questions to add this year. So many questions were added around the impact of the pandemic and other sort of important topics. We completed in the past 6 months about 9,000 live interviews around the state. So it's a really large data set, 554 interviews in the Valley. And to the extent that that's not enough surveys, we can also look back at the previous surveys in order to really get granular information about like very specific groups. So it's a lot of interviews, a lot of labor went into the interviews with different residents throughout the area, and they're all randomly selected. So it's a highly representative group in terms of age, race, gender, neighborhood. And the interviews are, after they're conducted, we weight the interviews based on the 2020 census data to make sure that the people who responded represent the populations in each of the areas. So, one thing that sort of struck me looking at sort of community level quality of life data, like whether you have nice parks in your area or if the Valley is a good place to raise kids, a lot of those things did not change much since 2018. People still have, high, positive, generally perceptions of the Valley, similar to the state. There are differences, you'll see on a lot of these slides, like the breakdown by age, race, education level, and income. And on some of these community level measures, there's not, a huge difference. Some are important differences, but not as large as we might see in other parts of the state. Other measures in the survey include questions like whether people feel safe walking at night. You could see whether people trust their neighbors. So those are sort of things that may vary within the Valley in important ways, even though the Valley as a whole looks like it's doing pretty well. Once you break it down within the Valley, you'll see, women feel less safe walking at night than men, for example. In certain neighborhoods, there's some concerns about that. And then, this is a slide that Jess Christie asked for from the health department, sort of this question about whether you trust your government institutions, trust the police. We asked some questions about that, given the importance of the of government during the pandemic and how people trust the advice coming from the federal government or from the state government. So you could see in the Valley, there were fewer adults who have like a lot of trust in the federal government, a little bit fewer who trust the state government, but in terms of whether people trust their local health officials, we're about the same as the state on that measure. So these are important, just sort of interesting data, but also like if you're thinking about where messages are coming from and also just sort of general attitudes about things like, federal health programs or other investments could be important. This slide shows the share of residents who faced various hardships during the pandemic, who lost their job, used a food bank or like a food pantry, emergency food service, or if they were worse off financially during the pandemic. And you could see here, there's like much larger differences by income and other factors, by gender and race. And, even though the Valley, is fairly similar to the state, those top two lines show, about 23% of Connecticut households, 25% of Valley households lost their job. There are large differences. So if you look by race, ethnicity, for example, about 40% of households in Black and Latino communities within the Valley lost their job. And if you sort of aggregate these together, probably more than, probably about half of residents faced, at least one of these things. So these are sort of presenting them individually, but a lot of people would face like two or more of these things happening to them within the past year. So there has been a lot of hardship. It can, research suggests these things can affect people's, well-being and their quality of life. So that's something to consider more as we go about writing the report. Similarly, one thing that was also interesting is this measure of healthcare access. And we do ask a question, it's a very commonly used survey question about whether you didn't get the healthcare you needed. So it's not looking at like, do you have health insurance, but it is asking people directly, was there a time when you really needed to get healthcare, but you just couldn't get it? So on that measure, you could get top 11% of Connecticut residents just didn't get the healthcare they needed. More of them sort of delayed it or postponed it. But the most important measure, I think, is people who just didn't get it. And you could see the Valley, that was 14% in the Valley. So that was a reversal from the past few surveys where, the Valley residents tended to say they had more access to healthcare. They weren't really missing appointments as much. In this past survey in 2021, we saw a large increase in the number of Valley residents who said they, were not getting the healthcare they needed. And something to consider. What the reasons for that could just be reasons related to the pandemic. So, not wanting to go to doctor's offices during the height of the pandemic, for example. And then other measures, you can see large health disparities, so by income or socioeconomic status. In addition, many more women than men delayed medical care. So there's a lot been written and researched about that, why women were more likely to not get care or to avoid care during the pandemic. That could be something to explore. So, we also saw general, questions about mental health in the Valley. We asked about anxiety, depression, sort of self-rated health. That was another area where we saw a bit of a shift, whereas in the past, the self-rated health, which is like how people feel, basically, it's a very good survey question for measuring people's general health. It really predicts like whether they're going to be healthy in the future and go to need health services. So that we did see some changes there where middle-aged adults in the Valley, their self-rated health was less than it was before the pandemic. So we don't know the reasons for that yet, but it's something that really kind of stood out to me. And I'm actually curious about the reason for it, because we didn't, generally didn't see such a shift there. And it could just be like the stress of the pandemic. It might be people felt just didn't feel as well as they had, in the past, just given, all the stresses and having to stay home and all of that. But those are a few things that we observed. And also, of course, like with anything, there's a lot of health disparities in terms of mental health. These are some of the more common health risk measures, like smoking. There was some good news here. I think the smoking rate previous, like in 2018, 2015, when we were doing the survey, a pretty good number of Valley adults were smoking cigarettes still. It looks like that number has come down a bit. So that was kind of a good piece of news, given that cigarette smoking is still, a major concern. So we saw that decrease. And then, these are health disparities that are pretty similar, I would say, across the state, but important to keep in mind in the Valley. Sometimes people may think like the Valley is, fairly self-contained area. The population's not as large as the state, so maybe there aren't as many health disparities, but when you really drill down to the towns and the neighborhoods in the Valley, you really see the same sort of differences in health status that you would see in other parts of the state. Opioid data we have, from other sources. So I put in sort of an up-to-date chart, and this was, we knew that prior to 2020, there were many opioid overdoses in the Valley. It had become one of the leading causes of death in the Valley, but it seems like the rate has increased further into 2020, 2021. And it is true, like throughout the state, the rate has continued to go up during the pandemic, but it looks like maybe in the Valley, the rate has increased maybe even a little bit more. So it's actually higher in the Valley than in these other larger metropolitan areas. There's also an increase in the number of alcohol-related overdoses. So that's something to maybe look into in the index. And then this chart shows the mortality rates prior to age 75. So basically premature death or, untimely deaths. And again, you could see heart disease, cancer, and overdoses, which is at the bottom here under injury. Those causes of death among younger adults are still, still elevated versus the state as a whole. Over the past few years, we were able to get the raw data from the State Department of Public Health on, death records, and so we could even add COVID-19 there. That shows, the rates of people dying from COVID-19 were a bit higher in the Valley than they were in the state as a whole as well. So those are still, major health issues to consider. Heart disease, the health department did a movie, like a documentary video about last year that interviewed residents in the Valley about, how to prevent heart disease. And I know that's been a focus. So hopefully there's progress being made. That disparity between the state and the Valley has been decreasing. So that's something to look at. And these are the three issues that really stand out to us are like, higher heart disease rates, maybe because of the higher smoking rates that have been seen in the Valley in the past, and overdoses, and then, the issues related to COVID-19. Since the last index was published, we've also created these town equity reports. I'm not sure if all of you are familiar with these, but on our site, we have a mini index or a mini data profile for each town in the Valley. So those are a good starting place too, if you're thinking about like, all the information that could go into the index around economic issues, educational issues in schools, that sort of thing. If you go to the town equity report, it could be a good briefing, and you'll find one for each town. So that will give you some census data about the individual town, some of the health data about the town, and civic data. Like this is an example from Oxford, Connecticut. So you could see how residents in Oxford trust their neighbors versus the state, and other sort of indicators about Oxford specifically. So that could be a good place to look as you're sort of preparing for the work groups, thinking about what data is out there. Those town reports have for each town in the state, there's about a 30-page report that has these sorts of charts and graphics. So those will be an important part of the index for 2022, because we'll update them, obviously to match the main document. So that's all I have. If anyone has questions about kind of the survey data, obviously there's like much more in the survey and then many more other data sources, but I just wanted to give you a few highlights for now.
Thank you so much, Mark. What I have noticed, there are two questions so far in the chat. One of them is the question about the medical care questions that you all did in the survey. Have you been able to distinguish between illness or versus preventative care or lack of preventative care?
Yeah, so the survey asks about current chronic diseases. So, asthma, diabetes, and then on the medical care questions, we ask basically why people postponed care or didn't get health care they needed, as well as if they have a medical home. So those are sort of the most common care questions. In terms of prevention, yeah, we also ask about dentist visits and things. So there's other information out there about, sort of staying healthy, like exercising, visiting the dentist. Preventive care can also be seen through the hospital records that hopefully we'll be getting from the Hospital Association again. So things like, again, dental care and kind of issues that, in a place where there's a lot of good preventive care, you wouldn't see as many of those visits to the emergency room or the hospital. So there are a few different ways to get at those differences. It is harder with the mental health questions. It's just getting data on preventive care in addiction medicine, for example, is a little bit more challenging because it is more complicated. So we tend to look at the outcomes like overdoses and emergency room visits. There, it's a little bit harder to know whether the prevention programs are reaching the right people and if they're at the right scale. We've had a lot of discussions around that and how that is measured, because sometimes people come into a program for a month, sometimes they're there for a year or two, and just being able to compare those different trajectories of people is a challenge.
Thank you. And Pam Motti, I am going to put you on the spot for just a quick minute. Last week, I was in a meeting with Pam and her team about this question of prevention and the increase in the tremendous increase in overdoses. And Pam, I think it's really important for everyone on this call to know that you all have been working to survey the students in the Valley and how that can hopefully help inform this work for the index for us going forward.
Yeah, so thanks, Val. And sorry, my camera's not on everyone. I'm having the internet's unstable going on today, and it dropped a Teams meeting earlier. So my bad on that. But yeah, so we have just finished doing our student surveys with Ansonia, Derby, and Shelton. Derby High School, it was all grades besides 7th grade. And in Shelton and Ansonia, it was grades 7, 9, and 11. We should be getting the data back mid-April. And as part of our CARA, which is the Comprehensive Addiction Recovery Act, with our Valley Opioid Task Force to reduce use among youth, through that funding, we were able to do the grant survey again. So we'll get at least the perception of harm. We'll understand what substances the students are using and how that transitions to the lives that we're losing with our older adults, you know, with that age range of, it's usually 18 to 54 that we're seeing in the overdoses. But at the same time, we're also doing a community survey of adults in the community. So we have that ongoing right now too, and those results will come back to see, so we could do focus groups with the kids and the adults to see what is the differences with perceptions and availability. So I think that's going to help a lot moving forward, and how this data is going to roll into our new health index, because for once they're at the same time.
Thank you so much, Pam, and
You're
we're
welcome.
excited about that as well. Absolutely.
I'm so excited it works together for once.
For once, all good. Thank you. And I see that we have an equity question from Corinne Fucci at the Literacy Volunteers for Greater New Haven in the Valley. Were those as Asians surveyed as residents who live in Afghanistan, for example, may identify themselves as Asian? Or, Mark, is this an example of a hard to reach population that we're hoping to reach in this index?
Yeah, so all residents were surveyed, so we don't include Asian in the data that I just showed, because the number of Asians in the Valley would be too small. So I didn't include the data for them, though we could go back through, you know, previous surveys to look at Asians in the Valley. We have that data more like at the county or the state level, usually, just given the population sizes are smaller. And then I think residents from Afghanistan or refugees, that would be a bit of a different question. I think that group is also much smaller than that. So, you know, you're talking in the hundreds of residents. So for that group, you know, if you wanted to include their thoughts in the index, working with those communities directly, doing outreach and focus groups would be the right way to, you know, identify, you know, needs of that population that's been, you know, they're more residents in the Valley who may be refugees, maybe for a number of reasons, like residents who came after hurricanes or after wars. Each of those groups may have special circumstances and needs. So the way to reach them would be more through like direct outreach or focus groups.
Thanks, Mark, and thank you, Susan Agami from Spooner House, to further clarify her question about the medical care. So I'm gonna try and do this a bit more justice. She is curious if people delayed or didn't get medical care for illness, or if it was things like routine physicals like mammograms, etc., because she thinks that people interpret the term medical care differently. So if you can comment on that just a bit, that would be helpful.
Yeah, we did ask if people missed care, like what they missed. So certainly things like dental visits, routine care, you know, those come up. But it is hard to distinguish between like what's routine versus what can save your life, you know. So that's where, you know, more, you know, maybe some of the health providers know more about that. There certainly are like lots of anecdotes about people, you know, missing care now for the past 2 years, and then their illness getting worse over that time. So it is a concern if people are still avoiding healthcare, if they're, you know, avoiding those checkups and things like that. It can have effects down the road. So, but that's a little bit more of it's a harder thing to measure directly through a survey. I would say it's a, you know, more nuanced issue.
Thank you so much. And I'm sure that all of you on the call this morning have realized, as we've listened to what Mark has said, that there are many different nuances that will come out again during this round of the survey, right? And this round of working on the report together. And I think that that's why it is so critical for all of you to have as much input into this process, so that we can lift up those data points that are so important to the work that is being done in the Valley. I'd like to just ask if anybody has any additional questions before we turn over to Sharon, who has a few more things that she would like to share with us as it relates to the deeper dives that we can do into this work. So having seen none, Sharon, I'm going to turn this back over to you. And as I mentioned before, please feel free to get any other questions, because I know that sometimes when we're on these calls, especially first thing on a Monday, we're like, my goodness, I should have asked this question, right? You know where to find me. You can send me an email and I will make sure to get that information over to Mark. And I will also be getting that information out to you to be scheduling the work groups. So Sharon.
Great. Thank you. And thank you all for presenting this morning, and everybody who's on the call. I've had the chance to kind of look through the participants today, and I'm so pleased that we have, you know, people from our schools, people from our economic development, people from, of course, the health districts and everything associated with health. It is critically important for all of you to participate in this process, because every one of you has something to add. Our housing, affordable housing versus, you know, we see all of those new housing, the housing stock in Shelton raising up, but how much of that is affordable, right? You know, we see our education. You're hearing how critically important the work that Pam Motti is doing with your schools. You have our kids, the people in the school districts, you guys have our kids a good majority of the time. You know so much more of what's going on with our kids, that you can raise those questions up. And one of the things that I think is really important for you to all understand is that this work has been going on. Mark started the survey, I don't know, 8 months ago, Mark, or something along those lines. We haven't been in touch with you yet until we know we wanted to start getting you guys into the groups. And this is going to be a fast turnaround time. I'm looking at, you know, we're having a community conversation in June, and we want to make sure that all of you can get out to your communities to say, hey, there's a community conversation going on June 9th. We'd really like, you know, they'd like to have community participation and get those people there, because right after that, they've got to get that CHA done, the community health needs assessment done, and then they have to turn around and get these reports out. Mark needs to get everything, I'm looking at it, he needs to get everything for the community health needs assessment over to Griffin by September 30th in hand, so that they can turn it around and do these things. So it isn't this big time frame that you're going to have. It's going to be click, 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 that everybody is going to be we're going to be in touch with you to say, can you give us input? Now, one of the wonderful things that Mark has included this time around is the opportunity for us to have 4 to 6 topics to go into a deeper dive. So as you know, with the community index, they're broad, some of them are very broad strokes, but sometimes you want to go into that deeper dive. And, you know, it could be about the opioid crisis. It could be about mental health. It could be about our aging population. It could be about maternal health. It could be so many different things. And we need to hear from you of what do you want to suggest as a deeper dive? And everybody's going to have its own, you're going to have your own opinion. And probably once we collect all of your opinions, we'll send it out saying, okay, we need to narrow this down to 4, 5, 6 of these deeper dive questions for DataHaven to start exploring those deeper dives in the process of them collecting data. So I want to put that in your thought process right now to say, what would you like to see in your area to have as a deeper dive? We're not going to be able to do everybody's, but let's see where there's an overlap of what people would really like to see to have a deeper dive. As Val had indicated, we know equity is going to be an overarching in every one of our categories or every one of our chapters to say what's going on with equity. And as Mark indicated, he's got those equity reports out on his website right now. You can just go, and every one of the communities that you serve, you can go and collect that information as of right now to give you an idea of, as Mark said, to maybe do a deeper dive and say, what is this data fact about? So I'm going to really encourage you all to really be thinking about this, because I'm going to say that, you know, it's going to be a fast kind of turnaround. It really is. The time goes by faster than you can imagine. And, you know, we do plan on having the not community conversation, but the community presentation, as we have done in the past in the October-November timeframe. Remember where we went over to Cinto and we had the auditorium? We're going to be doing something like that again. It's crazy to say that the last time we did the 2019 index, 3 months later, we had the pandemic. And we had all these copies of the index. We had the whole presentation ready to roll out and everything else. And we didn't get to share with very many people in the community. So we know this time we're hoping it's going to be different and we're going to be able to share this information. So we want this to be really just a really great index this time around. So I don't know if anybody has any other questions again, but I'm going to turn it over to you, Val, and you can close up, and then if there's any questions, you can monitor those for us too.
Thank you, Sharon. I really am so very grateful once again for everybody's time and energy and commitment to this process. You can see from the information that David Morgan put in the chat, people are willing to share all of this information out. And that's exactly what we need you to do. We need you to bring your content area, your expertise in your subject matter area to this work. And as Sharon said, it's going to be a very quick 6 to 8 month process, and we're going to do it together, as we always do in Valley fashion, by collaborating and listening to one another. So on behalf of everyone on this team and everyone who helped put this program together this morning, thank you all for your expertise and for sharing your information. You have 4 minutes back of your schedule to go back out this morning and start your day. And again, you know where to find me if you have any questions or concerns. Thank you, Mark. Thank you, Monica, Jess, Allison, Sharon, everyone here for sharing all of this information. Have a great rest of your day.
Thank you, everybody. Have a good day.